Good morning, welcome. I'm Dr. Vasantha Naidu, practicing pediatrician and one of the Balaji family member. It gives me immense pleasure to welcome you all for this panel discussion on the health awareness of COVID-19 on behalf of Balaji Temple. We have been conducting health fair for the last 15 years. Lot of devotees look forward for this event yearly. This year, we changed the format to health awareness panel discussion due to global COVID pandemic we are all facing. This impacts everyone irrespective of race, gender, age or country. We are bombarded with a lot of questions through social media and news. We wanted to make sure to clarify fact versus fiction. Today, we have with us our panelists to address questions and concerns you may have. Please welcome our panelists, Dr. Deepika Ujjayi, an infectious disease specialist, Dr. Vijay Susalla, a clinical psychologist, and Dr. Sri Sakti Ramanathan, a dietitian and a nutritionist. We also have with us Hansaveda members to show us the practical approach how to lead a healthy life. We are pleased to have with us our trustees and past president of Balaji Temple, Dr. Kapalabhati and Dr. N.S. Rao moderating this event. I hope they all will enlighten us with some new facts about COVID. Any questions you may have, please enter in the chat box and we will do our best to answer it. Last but not least, I want to thank Mrs. Radhika Padi, Mr. Anu Agnigotri and Mr. Ramesh Chittur for all the support and assistance given in making this event possible. Now, I invite Radhika to take over the floor.
Namaste, I am Radhika Pati, a member of Balaji family and Hansaveda Sangha. I want to start with a small story about an Italian who was discharged from the hospital after COVID. His face went pale when he saw the bill for the one day he was on a respirator and started crying. Hospital authorities consoled him that he could pay in installments. The patient spoke that I'm not crying for the bill I had to pay, but was thinking of God who has oxygenated me freely for so many years. And I have paid him nothing. Such is the grace of God, oxygen and prana. Lord Balaji has brought Hansavedas to teach the importance of utilizing prana, God's gift of oxygen. It's a true honor to introduce Meenakshi Acharya and Rajini Jagarlamudi, disciples of our Sadguru and a realized monk, Swami Vidyadhishananda. It's a blessing to learn about Pranayama and kriyavinyasa to remain healthy. Meenakshi will guide us on the Himalayan Pranayama techniques and Rajini will focus on Talasana Vinyasa. Thank you.
Namaste. My name is Meenakshi, and I will be guiding the practice of Pranayama as taught by Swami Vidyadhishananda. We'll start with Kapalabhati Vinyasa Krama. It's a wonderful way to expel the stale air in your lower lungs. Start by sitting in Virjasana on your heels, toes pointed behind you. Kapalabhati is a forceful exhalation where you are pushing the belly button towards your spine, and the inhalation happens as a natural reflex, like this. We will do this practice of 18 breaths in 3 positions. The first position is like this, with palms on your thighs. The next position is arms or fingers interlaced above your head like this. Third position will be crossing at the wrist, palms on your shoulder blades. And we will end with an inhale and an exhale back to the starting position. So let's begin. Start with an exhale, inhale, and begin. Inhale up and begin. Inhale to third position and begin. Inhale up, exhale down. Now we will practice the Ujjayi breath, a foundational breath. Start by sitting in a symmetrical posture on the floor, as in Padmasana, as I am, or on a chair. Make sure your back is not reclining on anything. And the mudra is interlace fingers, left thumb over the right, resting in your lap. The control of the breath is attained in the throat, at the glottis, and hence the Ujjayi breath is often called the throated breath. And you will hear a slight hissing sound like this. So focus at the back of the throat as you inhale, expanding the belly or the core outward. And on the exhalation, using the same throated breath while pushing the core, your belly button, towards your spine. As you do this technique, gather your mind to focus on one point of contemplation, be it an empty void, a tranquil thought, or thought on God. We'll start with the warm-up of the Ujjayi breath, 3 breaths, starting with 3 seconds, moving to 6 seconds, and then progressing to 8 seconds. So first start with an exhale and inhale for 3. 1, 2, 3, pause. Exhale, 1, 2, 3, pause. Inhale for 6. 1, 2, 3, 4, 5, 6, pause. Exhale for 6. 1, 2, 3, 4, 5, 6, pause. Inhale for 8. 1, 2, 3, 4, 5, 6, 7, 8, pause. Exhale, 1, 2, 3, 4, 5, 6, 7, 8, and relax your breath. So we will be using this Ujjayi breath synchronized with the Om sound vibration at 432 Hertz. Timed at 8-second exhalation, pause, 3-second pause, and an 8-second inhalation. When you hear the Om chanting, that's the indication of the inhalation. When you hear the bell, that's the indication of the exhalation. We'll do this practice for 5 minutes. This practice is found on our app. Search for Hansaveda's Academy in your app store and download it. We'll start the practice right now. Start with the exhalation. Inhale. Exhale. Our last technique is Anulom Vilom, or alternate nostril breathing, which brings about the purification of the principal group of nadis, the Ida and the Pingala, and balances the right and left sympathetic ganglion. This method assists in opening up the Sushumna Nadi, which is the nadi aligned with the spinal cord. So the mudra for the technique is right thumb on your right nostril, left 2 fingers on your left nostril, and the middle fingers hover right in front of your 2 eyebrows near the kutastha. Okay? So we'll start with the technique is right nostril is closed, left nostril is open. We exhale through the left, inhale through the left, close the left nostril, open the right, exhale through the right, inhale through the right, close the right, and exhale through the left. And in between, there's just a brief pause. Okay? So we'll start the technique with a count of 6, inhale, pause, 6, exhale. Second count. All right? So let's begin. Right nostril is closed, left nostril is open, and start with an exhale to get the remnant breath out, pause, and inhale for 6 through the left. 1, 2, 3, 4, 5, 6. Close left, open right, exhale. 1, 2, 3, 4, 5, 6. Inhale right. 1, 2, 3, 4, 5, 6. Exhale left. 1, 2, 3, 4, 5, 6. Inhale left. 1, 2, 3, 4, 5, 6. Exhale right. 1, 2, 3, 4, 5, 6. Inhale right. 1, 2, 3, 4, 5, 6. Exhale left. 1, 2, 3, 4, 5, 6. Inhale left. 1, 2, 3, 4, 5, 6. Exhale right. 1, 2, 3, 4, 5, 6. Inhale right. 1, 2, 3, 4, 5, 6. Exhale left. 1, 2, 3, 4, 5, 6. And relax your hand. Resume your natural, gentle breath. And you could use this technique by increasing the count from 6 to 9 to 12 to 18 as per your capacity. Thank you for joining us.
Namaste, I'm Rajini and I'm going to show you the practice of Talasana and Parvatasana. The practice of Talasana is very simple, and when it is combined with Ujjayi breath, it is so profound and the benefits are endless. It is simple that you can do it anywhere. Best done where there is good airflow. The practice starts with a samasthiti, standing on your feet, balancing your weight on both feet and having a focus inward. Success of this practice relies on how the mind guides the breath during the movement. This sequence oxygenates and works your entire body. This movement stretches the diaphragm, clearing the lungs, massaging the heart, and is deemed good for lymphatic drainage. We will start the practice with Parvatasana, sitting down comfortably. Every movement has an opposing movement to counterbalance. Breath will be about 6 seconds long inhalation, and there's a 3-second pause, and 6-second exhalation. Thank you. We're going to start with Parvatasana. Exhale first. Inhale up. Pause. Exhale, right bend. Pause. Inhale, center. Pause. Exhale, left. Pause. Inhale, center. Pause. Exhale, right twist. Pause. Inhale, center. Pause. Exhale, left twist. Pause. Inhale, center. Pause. Exhale, forward. Pause. Inhale, back. Looking at your fingertips. Exhale to Samasthiti. Now we are going to do the Talasana. Exhale first. Shoulders back, feet together, slightly apart. Spread your toes and put them back on the mat. Inhale. Exhale to Samasthiti. Inhale, shoulder length. Exhale, palms on your hips. Inhale, shoulder length. Exhale, palms on your hips. Inhale up. Exhale, Samasthiti. Inhale up. Exhale, palms behind your neck. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, releasing your palms onto your shoulder blades. Inhale up. Exhale down. Inhale up. Exhale, palms crossing on your shoulder blades. Inhale up. Exhale, opposite palms on your shoulder blades. Inhale up. Exhale to Samasthiti. Inhale, shoulder length. Exhale, right twist. Looking at your fingertips. Inhale, center. Exhale, left twist. Looking at your fingertips. Inhale, center. Exhale to Samasthiti. Inhale, back Namaskar. Exhale, right twist. Inhale, center. Exhale, left twist. Inhale, center. Exhale to Samasthiti. Inhale up. Exhale, right twist. Looking up at your fingertips. Inhale, center. Exhale, left twist. Looking up at your fingertips. Inhale, center. Exhale to Samasthiti. Inhale up. Exhale, arching back. Arms forward. Inhale up, side arms and up. Exhale, forward and side. Inhale up. Exhale, down. Inhale up. Exhale, right bend. Inhale, center. Exhale, left bend. Inhale, center. Exhale to Samasthiti. Inhale up. Exhale, forward bend. Arms in front of you. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, arms to your sides, bending at the waist. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, arms interlaced, bending at the waist. Inhale up. Exhale, down. Inhale up. Exhale to shoulder length. Inhale, back Namaskar. Exhale, bending at the waist. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, releasing your arms all the way down to your toe, touching your toes. Inhale up. Exhale to Samasthiti. Inhale up. Exhale down, all the way touching, putting your arms at the side of your feet. Inhale up. Exhale down. Inhale up. Exhale onto the right side. Inhale up. Exhale to the left side, arms interlaced. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, folding your arms at the back. Inhale back. Exhale forward, all the way down. Inhale back. Exhale to Samasthiti. Inhale up. Exhale to back namaskar. Inhale back. Exhale forward, all the way down. Inhale back. Exhale to Samasthiti. Inhale up. Exhale, arms forward to a half squat. Inhale up. Exhale to Samasthiti. Inhale up. Exhale to half squat with arms on your sides. Inhale up. Exhale to Samasthiti. Inhale up. Exhale, arms interlaced, half squat. Inhale up. Exhale down. Inhale up. Exhale, arms on your shoulder blades. Inhale up. Exhale to Samasthiti. Inhale, back Namaskar. Exhale, half squat. Inhale up. Exhale to Samasthiti. We're going to go to full squats. Inhale up. Exhale, arms forward to a full squat. Inhale up. Exhale down. Inhale up. Exhale, arms to your sides. Inhale up. Exhale down. Inhale up. Exhale down, arms interlaced. Inhale up. Exhale down. Inhale, back Namaskar. Exhale down. Inhale up. Exhale to Samasthiti. Inhale up. Exhale to Samasthiti. Inhale up. Exhale down.
We offer our gratitude for Hansavedas, especially Rajini Jagannathmudi and Meenakshi Acharya, for guiding the practice of Pranayama and Talasana practice. Hansavedas Academy offers a free online content on Pranayama, the breathing techniques, guided meditation, and wisdom teachings. Please feel free to download the app for further details. Our Hansavedas Sangha has been practicing the pranayama techniques for an hour every day during the pandemic. I noticed that we had a high vital energy for the rest of the day. I know it is challenging for most of us to give that 1 hour of time for ourselves. But believe me, the benefits you get and the productivity after that hour becomes double what you generally get. A 75-year-old young woman whose routine is like a swimming, health clubs, found more mobility after practicing pranayama and talasana. And another gentleman who couldn't even stand was able to stand for 30 minutes, believe me, without a struggle. So it is imperative that we give ourselves some time to do the practices to stay healthy. Now, I have so much energy after this practice today. I have the desire to get more knowledge from the learned panelists. Now, Dr. Ramaraj Yadavarthi, Vice President of Balaji Temple, will start the panel discussion. Namaste.
Good morning. My name is Dr. Ramaraja Yalavarthi. I have a great pleasure in introducing Dr. Deepika Buchpalli. She is a graduate of Dr. MGR Medical University in Chennai, India. She has a master's degree in microbiology from the University of North Dakota Medical Sciences. She completed her fellowship in infectious diseases at the Loyola University Medical Center in Chicago. Dr. Buchpalli has been a member of Southwest Infectious Disease Associates at Amita St. Joseph Medical Center in Joliet and Silver Cross Hospitals in New Lenox. I personally know that she is one of the most sought-after ID specialists at Silver Cross Hospital. Dr. Buchpalli is board certified in internal medicine and infectious diseases. And I now request her to speak about COVID-19, the myths and facts, and after that I'll ask her a few questions. And please send in your questions through the chat if you have any questions about COVID-19. Thank you very much. Welcome. Deepika.
Hello everyone. I'm going to give you a brief overview of coronavirus or COVID-19. What is COVID-19? COVID-19 is a novel coronavirus that was identified in late 2019 in Wuhan, China. And since then, it's spread to almost all countries in the world and has ravaged many lives and affected many people. As of today, it's affected more than 23 million people and has caused more than 800,000 deaths. And in March 2020, the World Health Organization has declared it a global pandemic. How does COVID-19 spread? It spreads through close contact with any person within 6 feet distance, primarily through respiratory droplets. So if you cough, you sneeze, you talk, even when you sing, you can disperse these infectious droplets in the air. And if you're in close contact with a person who is dispersing these particles, you can get infected. It enters your body through your nose, your mouth, or your eyes, through the mucosal membranes, and then invades the body. What are its most common symptoms? A study by CDC of 370,000 patients found that cough was the primary symptom in most cases. About 50% of patients presented with a cough. The next common symptom is fever. Over 43% presented with a fever. Other symptoms that could present in patients with COVID would be myalgias, headache, fatigue, loss of smell, taste, which is a new symptom that they've seen with COVID-19. You can also have GI symptoms like nausea, vomiting, diarrhea, loss of appetite. Some patients present with shortness of breath too. What are the most common complications? So most of the patients who get infected with COVID-19, majority of patients have a mild illness or even could be asymptomatic, presenting with no symptoms. But probably about 20% can present with moderate symptoms. About 5% can go on to have severe symptoms. What are its most common complications? Most common complications, as we've seen, would be respiratory failure. These patients require a lot of oxygen and then might need to be on the ventilator too. Another common complication that we've seen in patients with COVID-19 is cardiac complications. They present like a heart attack and have elevated cardiac enzymes. And have an inflammation in the cardiac muscle or something called myocarditis. Another symptom would be renal failure. Patients present with liver failure. They're also present with blood clots. Patients present with stroke, with blood clots in the lungs and other parts of the body. Another symptom that is being seen most recently in children is something called a multi-system inflammatory syndrome, and it presents probably 4 to 6 weeks after the child gets sick, and they present with the inflammatory component of the infection. Who are at risk for severe COVID-19 infection? As we've seen, not all of them with COVID-19 have a severe or a bad outcome. But patients who are more at risk are patients with chronic medical conditions, like patients with chronic lung disease called COPD, patients with asthma, patients who have diabetes, hypertension, obesity, chronic kidney disease, congestive heart failure, also patients with solid organ transplant, or patients who are on immune suppressive medications. And I will,
Dr. Butchpal, that's very nice summary of COVID-19. When you watch the news, it seems like the world is going to come to an end with COVID-19. When you go outside, people behave like there is no COVID-19. How can it be prevented?
So, that's a great question, Dr. Yalavati. The main thing with COVID-19 is prevention, like try to avoid getting sick. As we know, it travels through close contact with people. So try to avoid people as much as you can. Like try avoiding large gatherings. Even indoor gatherings, keep it to a minimum. And there are 3 W's that have been asked to be practiced to prevent COVID-19. And they are: watch your distance, wear a mask, wash your hands. So make sure whenever you touch any surface, you wash your hands and avoid people as much as you can, and wear a mask at almost all times.
Okay, some people come and ask me, do I have COVID-19? What kind of tests are available to diagnose COVID-19?
The tests available for COVID-19 include a PCR test, which takes about a day or 2 to get the results back. There's another rapid test that are available too, and those results come out in 15 to 20 minutes. And we also have the antibody test, which do not measure if you have an acute COVID-19 infection, but can tell you if you've had the infection like 4 to 6 weeks ago.
Good. Are there any treatments available for COVID-19 now?
Yes, as we've learned more about this disease, we've identified certain treatments that seem to work in patients with COVID-19. With people who have mild disease, it's best to stay home, isolate yourself, hydrate yourself, and you can take symptomatic treatment, like take medications for fever, like Tylenol. You can also take anti-inflammatory medications like Advil. And the treatment that we offer in the hospitals there are 4 treatments that are being used in the hospitals right now for COVID-19. The first thing is the steroids, which has been shown to decrease mortality in patients with COVID-19. We give blood thinners or anticoagulations medications for COVID-19. And there's an antiviral medication which is under emergency use authorization by the FDA, and it's been shown to work in patients with severe COVID-19 infection, as well as the convalescent plasma that we have used in a subset of patients with good results.
In medicine, we always say an ounce of prevention is worth a pound of cure. It's better than a pound of cure. Is there a vaccine to prevent coronavirus?
There are vaccine studies and trials being carried on throughout the world. And in the US, the government has given 3 vaccine candidates the authorization to continue working on their studies to come up with a vaccine. And the 3 vaccine trials that are underway are the Moderna vaccine trial, the Oxford trial, AstraZeneca, and the Pfizer trial. And they're all in phase 3, meaning that they're being used on patients or people to try to see if it prevents them from getting a COVID-19 infection.
When do you think these vaccines will be available?
Well, we're hoping as soon as possible, but realistically it could be any time by later this year or in spring of 2021.
So these the COVID infections are going up and down, and different states react differently. What is the status of COVID-19 in the state of Illinois?
In the state of Illinois, unfortunately, we are seeing an uptick in cases. When I last checked it yesterday, the positivity rate was around 4.3%, which is kind of increased from a month ago. And it seems to be in certain regions where Illinois is divided into 11 regions, and different regions have different positivity rate, but on the whole it's about 4.3%.
Now, there is a joke about coronavirus going to God and told him that, I'm so powerful, I closed all your temples all around the world. And God said, no, not so fast. You may have closed the temples, but I have made every home a temple now. Everybody's praying at home. Nice. So don't be so cautious, so confident. So, being in a temple environment here, how do we protect the devotees of all ages that come to the temple, the priests and the volunteers here?
Right. There are certain steps you can take to protect the temple priests and the devotees. Like, try to limit exposure. Like, so if you can stay home, if you have to come to the temple, make sure you are not a high-risk individual. If you are a high-risk individual, I would recommend that you stay home until we learn more about this infection, we can get a vaccine. And if you do have to come into the temple, wear a mask, keep your social distancing 6 feet, try to avoid touching surfaces, and always wash your hands or use a hand sanitizer when you touch anything to prevent you from getting sick.
Good. We are trying to follow all those guidelines and as much as possible. As you know, we just opened the temple up for 9 to 9 visits as of yesterday, and we're seeing an increased amount of devotees coming to the temple. We'll try to implement all those precautions as much as we can, and we want the cooperation of all the devotees as well. So in case one of our employees turns positive for COVID-19, what kind of things shall we do?
Well, if the recommendation is to isolate the patient or the employee as soon as possible, try to identify close contacts of that employee and who he might have gotten in contact with in the last couple of days. And the close contact is defined as 15 minutes of exposure within 6 feet distance. And once you identify those individuals, they need to be quarantined for at least 14 days. And people who are high-risk individuals, I would recommend they get tested for COVID-19 and make sure they are not carrying the infection and just not symptomatic yet.
I think we have time for one more question. And I just want to know, there are so many hand washers available, sanitizers available all over the place. Is there any difference between these things? And is it good to wipe things down with Clorox or Lysol or anything like that? Does it help?
Yes, it does help to disinfect surfaces as often as you can, at least every hourly if they are high-risk surfaces or like surfaces that are being touched more frequently, to clean up the areas every day at least. And alcohol, hand sanitizers should have at least 70% isopropyl alcohol to be effective.
Excellent. So if you have any other questions, please send in through the chat and we'll address them at the end of the panel discussion. Thank you.
Through the chat, can you just ask a question?
I think we'll do it at the end of the panel discussion. After everybody presents. Right, Suresh?
Testing in the absence of symptoms, routine.
Well, in the absence of
the employees in the temple.
So if it's a priest who turns positive, and I would recommend the other priests get tested too, just because of the fact that the priests are meeting a lot more people, and I've heard that the priests go out to houses, like to other, for private pujas and ceremonies. So it would not be a bad idea to test the priest if one of the priests turns positive and to isolate them.
What if nobody is positive, but is it a good practice to test them on a regular basis? If they're asymptomatic?
For nursing homes, they have recommendations, like if a nursing home resident turns positive, then you need to test everybody in the same wing, same unit. I have not seen anything pertaining to places of worship or temples if everybody else needs to be tested on a regular basis.
Nursing home is basically it's a different thing because they're stagnant.
But there have been no guidelines.
Whereas this is a traveling population in a way, at the most 15 minutes. But given the false positives and false negatives, if any one of them turns into a false positive, false negative, that gives a different approach how to take care of it. So we weren't quite sure yet what to do with it.
Right. So like I said, there are no guidelines as such, but it would be, if there is a priest who turns positive, it's good to contact the health department and they might have good suggestions for what needs to be done at that point.
Thank you.
Thank you, Dr. Bujpali.
Thank you, Dr.
So we'll move on to the next presenter. I'd like Dr. Sudarshan Rao to introduce the next speaker.
It's my privilege to present Vijayalakshmi Susangla, who has a PhD. She's a practicing clinical psychologist with offices located in Naperville and Chicago. She has been in practice since 1995 under the practice name of Self-Improvement Through Awareness, called SITA. She is also the founder of Manodarshan, a foundation for mental health awareness. Its mission is to promote mental health awareness in our community and eradicate stigma through community engagement, service and research. She is doing monthly awareness talks on various topics related to mental health and illness and around Illinois. I would now request Viji, as we call her, to give us an update on the mental awareness during these turbulent times of COVID-19.
Thank you very much to you all. Thank you Balaji Temple for having this much needed conversation. I am more a clinician than a researcher, so I will speak from my practice. At this time, I'm receiving calls almost every day. I have a pretty long wait list. I'm working 6 days a week, 9 to 9, and so there is a lot of need for mental health practitioners. I would love to have a few more in my office, but I've been busy actually providing the service. What I'm seeing is a lot of children and college students are having the maximum number of problems. They're feeling anxious, they're feeling depressed, they're having panic attacks, productivity is dropping, grades are dropping, and temper tantrums and acting out has increased. It looks as though the most well-adjusted population seems to be 60 and above. For some reason, they seem to be able to deal with this crisis and stay-at-home precautions. They are dealing with it best. This is a very stressful time. The most difficult part of this stressful time is the uncertainty. And inevitably, uncertainty leads to a lack of control, a perceived lack of control. The less control we have, the more the symptomatology. So these are some of the things I'm noticing in my office on a day-to-day basis.
Dr. Vijay, I'd like to ask you some questions. What is the advice to the parents regarding the children, and especially so regarding the going to the school?
So one thing to remember when it comes to children is that children are watching adults carefully. They are watching adults to see how they are dealing with stressful situations. And if adults deal with this pandemic calmly and proactively, it's more likely that children feel reassured, and then they will also be calm. It is very important to limit exposure to news, especially for children. It will be good to have regular, maybe daily, huddle, family huddle, where, if there's any new information, it can be provided to the children. It's best to be honest with them, and it's very important to tweak the message based on the age of the child. The younger the child, the more reassuring the message should be. Yes, there is uncertainty, yes, there is a problem, but we as a family can deal with it. We have dealt with problems in our lives, we can deal with this problem too. If that is the general environment that is created in the family, the children will fare much better. It's important to make expectations clear in a reassuring way. For example, maintaining social distance, wearing the 3 W's that Dr. Buchpally talked about. It's very important to make that clear in a very simple manner, as simple as possible. For the younger children, it'll be nice to post the precautions in their bedroom or in the back room or somewhere like that, so that it is a cue on a regular basis for them. Another important aspect for children is to have a good routine. Because they are home from school, it is very, very important to have a good routine. So if the parents can develop a routine for themselves, show the kids that this is how they are dealing with the pandemic and their work obligations and home obligations, and then ask the children to make a routine for themselves, and they can tweak that depending on how it works. As I said earlier, having a routine gives a sense of control. And when human beings have a sense of control, they subjectively feel better, and they feel that they can deal with life. Now, it's very important to give time for children to express what they are feeling. Much of the times, parents try to tell the kids, do this, do this, do this, but really do not give the time for the children to talk about their fears and concerns. Most of the parents are very quick to reassure without giving the time for the children to talk about things. It's very important to let the children talk. It's also, parents should be watching for certain symptoms like excessive crying, toileting accidents, bedwetting, acting out, complaints of frequent headaches, stomach aches, poor eating or sleeping, anxiety attacks, withdrawing, dropping of grades. These are some of the things that parents need to pay attention to and give the time to explore what is going on. One other thing that they can do is to have creative activities, games and outings. I know a family, for example, they have decided that during this pandemic, they're going to master 10 board games, and they're going to paint their house. So these type of projects also help children to be engaged and to some extent distracted. So these are some of the things that parents can do for children. In terms of school, I'm a little confused about the school myself, because to me it seems like the best idea is to stay home. If I had a child who's going to school, I would have kept the child home. But then there are different opinions out there. So when my patients ask me, should I keep my child home or not, I myself am having a little difficulty. Of course, what I do is I explore their fears. So it is important for parents to explore their own fears and concerns about sending their children to school first. Then address the fears and concerns of the children. What are you worried about? Now, they need to reinforce the precautions that need to be taken in school on a regular basis. In fact, I suggest that they practice the precautions they need to take in school at home before they even go to school, and then reinforce them from time to time. So these are some of the things that can be done in terms of sending children to school.
So what's your general advice for the adults now regarding how to cope up with these turbulent times of COVID-19?
So one of the first things that I teach adults is to understand that it is normal to feel anxious when there is such a crisis in the world. So I ask them, every time you start feeling anxious, remind yourself that what you're experiencing is normal. Not only is it normal, it is necessary, because anxiety is an emotion that is telling us that there is a threat out there, and any emotion propels us to action. So when I feel anxious, I ask myself, what is the threat? Yes, there is this COVID. So then ask myself what it is that I can do about it. It is normal, of course, to feel concerned about not only ourselves but our loved ones that are around. The other thing I tell adults is that this is a really good time to develop resiliency skills. The idea that hardships come into our lives, but the human mind has the ability to come up with creative solutions to take care of those hardships. And we have done that over thousands of years, and we can do it again now. So that's another thing I try to impress on adults. I tell them to avoid excessive exposure to media. I suggest that you get news just once, maximum twice in a day. And again, social media is not the best source of information because it is replete with all kinds of COVID messages, conspiracy theories, cures and things like that. Another problem with constant exposure to news is that we tend to get numb after a while. If we listen to too much news, we tend to get numb. And when we become numb, we tend to get careless. And also, we forget to be proactive about things. We tend to get reactive about things. I tell parents to have a good routine. I said that before. Both the parents and the children should have a good routine. It's not written in stone. It can be flexible, but to have, that you do certain things during the day, like maybe some little exercise, some meditation, some relaxation, some study time, work time, things like that. Very important to keep connected with family and friends, whether it's phone calls, from my driveway to your driveway, it doesn't matter, maintaining the distance. It's very important to be connected. We also need to watch for severe symptoms, as I said, panic attacks, severe depression, withdrawal, these kinds of symptoms must be focused on. The last thing I tell parents is that I find that those who are involved in service activities seem to weather this very well. So those people who are making all those masks, turning out thousands of masks and sending them to various places, those people who call all the senior citizens living alone in their neighborhood, call them on a regular basis, ask them if they can do something. So any type of service activity seems to help people. And it's good to involve children in those service activities also.
Thank you, Vijayalakshmi. Now, please send in your questions because this is the best opportunity you have to ask Vijayalakshmi regarding any psychological questions to what topics we have. My privilege next is to present Satya Ramanathan, who's a registered dietitian, works as a community outreach dietitian for South Asian Cardiovascular Center at Lutheran General Hospital. And she has been involved with our temple activities for a long time. She was with health awareness. And now we'll give her the opportunity to tell us about nutrition during this COVID panel discussion. Thank you so much.
Thank you very much. Thanks to Balaji Temple for having me. And thank you, Deepika, Dr. Deepika and Dr. Susarla. That was really nice. So let's come to diet. So during this COVID, everybody, like Dr. Susarla said, there's a lot of media, YouTube channels, people have started cooking, and to pass time for boredom, people watch cooking shows or they want to try new recipes because they had all the time in their hands. Now it's changing a little bit, but in the middle, all of us were going through a phase where we wanted to try new things, and a lot of these things do involve a lot of oil. So I'm going to just talk a little bit about keeping ourselves healthy without gaining weight, and I'm going to talk about oil. So how much do we Indians need, how much oil should we use in a day? So to come to that answer, if we take, we Indians, we're about 5 feet 2 inches to 5 feet 5 inches on average. So I'm going to go by with a 1500 calorie diet approximately. So for a person who's on 1500 calories of calories a day, you only need 50 grams of fat. So this is a lot of numbers, right? I'll break it down for you. So half of that oil you should be using in your cooking. So 5 teaspoons, small teaspoons like this, 5 teaspoons per person per day. So if you're a family of 4 people, you can use 20 teaspoons of oil, but make sure you get into the practice of measuring out your oil. And so you can try all the recipes that are there on YouTube and everything, but just make sure you're mindful. Some of them will require frying. So what is the rule for frying? So there is no hard and fast rule, but the rule that I give people that helps them is 1 fried food per week. And it can be a bhaji, bonda, or it can be samosa or anything, or even a fried paratha, but just once a week. And so keep all of your recipes in the archive and try it slowly. Just don't try all of it at one time. So that is with oil, cooking oil, 5 teaspoons per person per day. And this is only half of your fat intake that you need. The rest of the half, I've just allotted it for ready-made foods that you might buy from outside. So this portion is from home cooking, and half of it can come from outside cooking. So that's an easy rule to shoot for. And then coming to what are good cooking oils, Indian cooking does need high temperature. And that high temperature is approximately 200 degrees Celsius, approximately 400 degrees Fahrenheit. You know, that temperature that's needed for the mustard to pop. You know how your mom tells you when the mustard pops, it's at the right temperature. So most of the oils do suit that. So refined olive oil will suit that, not extra virgin olive oil. So you can do anything from refined olive oil, canola oil, vegetable oil, sesame seed oil. But most importantly, it's actually the 5 teaspoons. So I'm not so worried about what type of oil. That will come second, but first you want to master using less amount of oil on a daily basis. And then next, most commonly I've been asked about, or do you have a question for me? Or
Yes, I do. Can drinking Nila Vembu concoction potion cure COVID or decrease my chances of getting COVID?
Yes, so Nilavembu Kashayam or Kalmeg, it's called Kalmeg in Hindi. And the actual English name, they call it green charita or Andrographis, let me look at that. Andrographis pinaculata, that's the name, but it's called Nilavembu. It's very popular in India. People are making decoctions or concoctions out of it. It is made up of 9 ingredients. So my take on this is there is no evidence that this will help cure COVID or it will help prevent COVID. And also there is no strong evidence that it can cure any of the other symptoms, but it has shown to improve symptoms. So body aches, mainly in the southern part of India, it was approved for dengue and malaria, where it was helping the body ache part of the symptoms. So it does not cure it. There's no evidence that says it can cure it. So what about, so should we drink it or not? That's the question everybody asks. So here are a few things I'm going to let you assess. So first, if you're a person without not taking any medications, any other medications or any other complications, then it's just like another tea. That you make a little portion, you make a tea out of it, one cup a day, it's okay. But if you are taking medications and if you have acidity, if you have other complications, there is no research to show if it interacts with medication. There is no research to show if it can be taken with Coumadin. Let's say if somebody is discharged after COVID on Coumadin or warfarin, and then we don't know if it will interact with that, or if it will interact with the blood pressure medicine. There is no evidence. So if you still strongly do want to take it, you have to, I would say maybe take it without, when it's not around any of your medication, but you should check with your doctor, and it's not recommended to take it on a 3 times a day or in large quantities. So if you're on medications, if you have other comorbidities, think twice. Preferably don't take it. If you don't have comorbidities and if you're a general healthy person, then go ahead, you can have 1 portion a day. Also, the other thing is, like Dr. Deepika said, it's not, your immune system, it's not just one part. There are many parts that make up the immune system and the response. There are many steps. So maybe the Nilavembu Kashayam only helps fulfill 1 step. You do need the other steps. And for that, what trumps everything is a balanced diet. So if you have a balanced diet, you can be guaranteed you're going to get all the micronutrients that are needed for every step in that immune response. And for some people, the immunity can take care of it. Some people, it will help them fight it. So yes, so the Nilavembu Kashayam, be very careful. If you are taking other medications, it's best to stay away from it.
Secondly, how much vegetables should I eat in a day to boost my immunity?
Okay, so I'll just give a general rough estimate based on the dietary guidelines for Americans, but we can also use that for other people, but that's the current guidelines that's out there. And so we've moved on from the My Pyramid, we're now with the My Plate. So a very good resource is choosemyplate.gov. I would recommend all of you to go check that out. It's very user-friendly. So it will go on to tell you that you need approximately 2.5 cups of vegetables per day. Doesn't matter if it's cooked or raw, just shoot for 2.5 cups per day for an adult. And if you go into choosemyplate.gov, you will see recommendations for every age group. And the vegetables and fruits are the place from where the micronutrients that help your immune system come from. So a balanced diet really trumps all other things. And if you don't have a balanced diet, then go for supplements.
I have one question from my point of view. What do you think of there are so many fads with diets. What do you think, or do you think a vegan diet is ideal for everybody, or non-vegetarian diet inclusive is one of the things that you have to think about?
Okay. So, yes, that's a tough question, but I'll try to give you as simple of an answer as I can. So, vegan diet gets its popularity because it has the lowest amount of inflammation that it can cause in your body. Number one, you have to be have a very good routine to follow that, be very well prepared, otherwise you will miss out on a lot of food groups if you're on a vegan diet. So if you are up for it, well prepared, if you've met with a dietitian to talk about how to have a well-balanced vegan diet, then you can go for it. It's a personal preference, no problem. As far as including meat and non-vegetarian items, so if you can limit your red meat to once a week, half a cup once a week, and if you want to pick from lean meat, that is okay, but portion size is just about half a cup per meal, not a lot. So if you want to be a mindful non-vegetarian eater, it's okay. Egg whites I do recommend. It's a great source of protein with no fat in it. So if you are able to have a well-balanced diet being a vegan, then go for it. Otherwise, do what you're doing and just be mindful of all the portions. Don't overeat any food group. That would be a safe bet.
Switching from eating to education, this is the time for schools reopening. Dr. Buchpally, you're a parent too. How do we handle this situation with kids going back to school? Some schools are going totally online, and some are going half in person and half online. And a lot of kids are in that dilemma now, and parents are in dilemma. They're constantly bickering about sending or not sending to school. So what's your stand on this?
I would say in the US we have 50 states and they're all governed by the governors, and every state has their own regulations, or even like COVID is behaving different in different states based on the practices there or the vulnerable populations there. So it's based on your county or your state. If there are state guidelines, then it will be based on that. But just a general guideline is that the positivity rates are high, then most of the school districts are opting to do remote learning. And also, if you cannot practice the social distancing, make sure that the teachers and the students have protective equipment, protective wear, or if there is no way you can contain an outbreak, then it's best to go remote learning. In other cases, when there are school districts, like my school district has opted for parents to choose remote learning versus in-person learning. And there are like 60% of parents who have opted for in-person learning. But the school has agreed to do that because they know they have all the measures in place to prevent kids and the teachers from getting infected, or if they get infected, to be able to contain it. And if that can be done, it's okay. The COVID-19 as such has fortunately shown to not affect kids a lot, and even if they do, it's a small percentage of kids who have underlying medical conditions who can get moderate to severe disease, which is a good thing, but it's still very preliminary studies. We have a lot to learn about this disease, but so far it seems like kids to a large extent are safe, but it's always good to do whatever you can to protect them and prevent them from getting an infection. So just parents watching for signs and symptoms, and making sure, or like Dr. Vijay had mentioned, talking to the kids more, especially if you're sending them to school, make sure they understand the importance or what they need to do to prevent them from getting infected, like wear your mask all the time, wash your hands, use the sanitizer, try to keep your distance from other kids. And I'm sure this is being talked about with the teachers too at school, but doing your part in educating the children too is important.
There's a question from one of the audiences. Does steam inhalation help? Because you've taken away the turmeric and all the other good stuff. How about steam inhalation?
Well, I don't know if I'm the right person. I don't know, or there are no really clinical trials or studies that have been done on it, but I would
Yes, I've not heard any, there are no studies on it showing that it can kill the virus. They think the steam can kill the virus, that there's no studies.
This question is for Dr. Vijay. With the COVID-19, people are depressed, gaining weight, staying at home, no social contacts even with family. One of my friends was saying that his grandkids visited them, but they wanted to stay outside, put a tent in the lawn and stayed there all night. So how do you cope with this situation?
Well, there is an attitudinal component to this, and there is a behavioral component. The attitudinal component is to have an overall understanding of what is going on Earth as a whole. On Earth, this is happening. So yes, I'm feeling isolated. I feel bad that my grandchildren are not giving me hugs and kisses, and I'm not able to cook for them and feed them in their mouth. Yes, it feels bad, but this overall perspective that this is something that I'm not the only one who's experiencing. This is an entire world phenomenon. If I keep that in my mind, it is easier for me to not only not feel so isolated, but even I will teach the kids that this is the right thing to do. Yes, come to my house, come every day if you want. We'll have a tent in the backyard and we'll do everything there. So that is what I would suggest.
This is for Sakti from the online. What are the extra precautions for diabetic patients? 1. 2, maybe a diabetic patient, what are the extra precautions to be taken? Is peanut oil better than canola oil?
Okay. So I'll just go with the peanut oil, canola oil first. Both are about the same. Peanut oil or canola oil is okay. Again, 5 teaspoons. So 5 teaspoons per day per person. And so that's for that. And the other question was, yes, for diabetic patients. So for diabetic patients, I wouldn't say, I don't know how well your diabetes is managed right now. So let's not say it as extra precaution. The precaution would be that have very good blood sugar control, and you have to be, having diabetes puts you at the higher risk, right? So then you have to be very, very, the 3 W's that Dr. Deepika said, you really have to follow that. And as far as diet, have very good blood sugar control. If you can do a televisit with a dietitian, or if you've already seen one, just make sure you're eating right amount of carbs at correct intervals, so you don't go into a low blood sugar or high blood sugar that can take you to the hospital. So I would say it would be regular recommendations, but just follow the 3 W's and be careful because you're at a higher risk.
This is for Vijay. Not only now, but during these turbulent times, we have a lot of problems with sleeping. Do you suggest any medications versus other thoughts about sleeplessness?
Now, I see sleeplessness everywhere, especially children, high school, college going kids, they sleep very little. And that works okay if they don't sleep well during summer, because they can sleep till 1 o'clock or 3 o'clock in the morning. But otherwise, if they have to go to school, it's becoming a big problem. Sleep is implicated in absolutely every physical illness, every psychological disorder. It is implicated. However, the way I look at medications is this. I'm a clinical psychologist. I do not prescribe medications. I always measure the severity of a problem on a 1 to 10 point scale. If the severity is 7, 8, 9, 10, I would suggest that they go and get some medication. You can start with the lowest. I don't know, some people prescribe, ask them to get the over-the-counter melatonin, and so on and so forth. But if it is anywhere below 6 and below, then I would teach them a host of techniques. So deep breathing techniques, guided relaxation, guided imagery, visualization, guided meditation, these kinds of techniques I teach. And then there is also sleep hygiene that I teach them, that you can make a decision when you want to go to bed and when you want to wake up. So if someone is falling asleep at 3 a.m., and they say, oh, I would like to sleep by midnight, I would tell them, let's first try 2 a.m. and then at that point use the guided meditation or relaxation and see if it helps them. So there are a few sleep hygiene techniques that I teach them. Anything below, there are a whole host of apps these days that are really very useful. There is one called Calm, there is another one called Headspace, there's another one called Insight Timer, and really there is so many of them these days. and they will provide guided meditation relaxation for sleep, for anxiety, for depression, for ADHD, for positive energy, you name it, they have it. So I encourage people, there are free apps too, I encourage people to download some of those apps and then make use of them. If not, YouTube has thousands of guided meditation, guided relaxation, videos. You can use those. So these are some of the things that I would suggest.
Thank you.
No wonder psychiatry is the busiest medical specialty during this COVID. I have a question for Dr. Bujpalli. Now that people are fed up staying at home, they now want to travel, they want to go to restaurants. Is there any advice you give to people who want to fly and dine out?
My advice is to avoid it as much as possible, and if you cannot avoid it, make sure you follow again the guidelines. Like if you're flying, preferably wear a face mask, which is like 3-layered. And to talk about masks, like there are different masks and different efficacy of those masks. So they say the more layers on a cloth mask, the better. So a 1-layered cloth mask is not good at all. A 2 or 3 layered, especially if it's the cotton polypropylene, is supposed to be a good mask. And if you can get a medical mask, you can get them at Costco too. So the better the mask, the more protection you get. And also, like Dr. Fauci had mentioned too, to wear a protective eye covering. Like if you're wearing like a protective eye shield or a face shield, especially if you're flying, would be good. Try to avoid, and I'm hoping most of the airlines are keeping the middle seat vacant. If you can, try to fly at not the busy times of the year, of the week or the day, and make sure you, again, social distancing, washing your hands when you touch anything, or using hand sanitizers, and going out to eat at restaurants. Again, it's like Dr. Vijay has mentioned, this is something that's it's never happened in our lifetimes. It's once in 100 years this has happened. So if you can understand that this is on a global scale, and this will pass, but while we are going through it or suffering through it, to avoid going outdoors, if you can avoid it. Even if you have to go to a restaurant, please take out, order and take out food. And if you have to go and dine in, like all the states have their own guidelines, right? So depending on your positivity rates, they don't even open up the restaurants, or preferably outdoor restaurants. In the winter, I'm not sure how it's going to be, but they want to have a minimum number of people in the restaurant. And unfortunately, indoor dining has been shown to increase the risk of acquiring or contracting COVID-19 infection. So avoid it as much as you can.
Follow up on that question, to say, what do people eat in restaurants?
What do people eat in restaurants? So that's eating in restaurants is your cheat day. So you can always have one cheat day where you eat your favorite foods, but just be mindful of the portion. Don't try to share the portion with your family members instead of having a whole portion of, let's say if it's a French fry and that's your cheat day, you want to eat it. Share it with somebody instead of finishing the whole thing. But what do people eat in the restaurants? Depends on, I think people just want to get out at this point. I think it's not about what they're going to eat. They just want to see people outside and enjoy the ambience.
This is for Deepika. University of Illinois has just come out with a saliva test. They say it is 97% positive. So do you have any thoughts on that part, and how is it going to be available to the rest of the people?
Yes, so the saliva-based COVID-19 diagnostic tests have just been authorized. They've received the emergency use authorization by the FDA, and 2 of the tests are the Yale test and the University of Illinois Urbana-Champaign test. And both are known to show similar results to the PCR or the rapid test, good sensitivity and good specificity. So yes, it's very good that we have these tests, because you don't have to go through it's very uncomfortable to getting the nasal test done, and this is a saliva-based test.
and it can be used on a lot more people. And right now they're using it only at the university, in University of Illinois, but they're hoping to ramp up production so then they can give it to the rest of the state, especially they want to use it more in schools, colleges, nursing homes probably, and then roll it out on a nationwide basis. But it's very promising and very encouraging.
So the cost of healthcare as it is phenomenal, and this is going to even increase the cost of healthcare on a global basis, and especially in underdeveloped countries, this has taken a big toll. And in middle class families, even in our parts of the country in India, are paying a big price for this. Is there any cheaper way or an effective way to control this or prevent this without going to the extent of being admitted to ICU and all that?
Well, prevention is better than cure, meaning like stay away from people, watch your, again, as I mentioned, social distancing. Preventing from going to the hospital, it would depend on the patients. If, like majority of patients who get COVID-19 have no symptoms or mild symptoms, so they would not require hospital admissions. But there is a percentage of patients, especially if they have high-risk conditions, who will need hospital admissions. And I'm not sure how it is done in India, but in the US, everybody gets the same care. And the government has been kind enough to make sure that people who don't have insurance don't get a large bill after they get out of the hospital for COVID-related admission. So that has been really nice in the US. In India, I'm not sure, but I've read and heard that there are a lot of government hospitals that are treating patients, and they do have the antiviral medication that we have, that they are offering, but I'm not very familiar with the cost in India.
Dr. Susarla, are there any avenues to help in this country? Do they have any public Zoom sessions from psychologists or psychiatrists to offer group sessions, counseling, etc.?
So there are almost all practices are doing teletherapy, and there are also teletherapy groups being offered. We are offering both of those in my practice, and all my colleagues, whoever I know, are offering teletherapy.
Good. I think we had a very interesting session. Thank you, the three eminent speakers highlighting the effects of COVID. On behalf of Aurora Sri Venkateswara Swami Temple, we thank you all for joining and tuning in to today's health awareness program on COVID-19. We usually conduct an annual health fair at the temple this time of the year. On account of the restrictions of COVID-19, we had to switch to online virtual health awareness program this year. But I'm glad you all were able to join us. We sincerely thank Dr. Deepika Bujpalli, Dr. Vijay Susarla, and Energetic Shakti for their excellent and informative presentations. We gratefully appreciate the organization of Dr. Vasanta Naidu and Radhika Pati for setting this up.
I have a couple of questions.
Okay, we'll get back to them in just a second. And I thank Ramesh Chittur, Anu Agnihotri, Satya Karumuri, Nagendra Vege, Bhargava, and Srini Srinivasan for organizational and technical support that they have given to this program. And if you have any questions, we still have a few minutes. Please send them through the chat. And we have a couple of questions, I believe.
Yeah, the first question is, as we head into flu season soon, what's your advice to get flu vaccinations? But since most of the people are working from home or kids are staying at home, do we really need the flu vaccine?
Yes, the CDC recommends that everyone gets the flu vaccine, and actually get it a little early, like starting September. Start getting appointments made for getting the flu shots in the pediatrician office or in health clinics. And even though you're staying at home and you're wearing a mask, it's still recommended to get the flu shot. And especially with COVID-19, we're still seeing a lot of COVID-19 in the community. It's best to be protected for the flu and prevent admissions to the hospital for flu illness, which will overwhelm the hospitals or the health system, as they're also taking care of COVID patients. So it would be recommended to get the flu shot.
What is the best time of the year to get the flu vaccine?
Usually starts around September is when the flu vaccine is recommended. Goes all the way until March. The earlier you get it, the better, because it takes at least 2 to 4 weeks for the body to develop immunity to the flu vaccine. So you want to get it a little in advance before flu starts appearing in the community.
Some people say you need to take 2 doses, one in the before the season and one after the winter, like one in September and another one at March. So is that true?
Not sure, but for elderly patients, it's recommended to get like a booster shot, like 2 shots within a short interval. There is some evidence that immunity wanes, so it could be that if you're a high-risk individual, you might want to get another shot in February if you get one early in the season.
It's a question for Dr. Deepika and for Sri Sakti. What do you think of high dosage of vitamin C, zinc, magnesium, and how do we find it in natural foods? So both of you can address those questions.
I can talk about
Yes.
there are few trials, but for COVID-19, there has been, it's not a randomized clinical trial, but there is some evidence that high dose of vitamin C, like 1000 milligram twice or thrice a day, has been shown to be helpful in increasing your immunity. There are a few studies that talk about melatonin and zinc. I'm not sure about magnesium, but I would defer the question to Sri Sakti to see what your thoughts are on.
Sure. So, like she said, there are trials being done. I want to just say that, you know, the daily recommendation for vitamin C is about 75 to 90 milligrams per day. You can easily actually get that from foods, but let's say you're a person that can't absorb it, or your diet is poor, then you'll need a supplement. So mega doses, there's still trials going on, but I'm going to recommend you meet the minimum, which is 75 to 90 milligrams for vitamin C, and zinc is just 8 to 11 milligrams. So what are food sources? So for zinc, especially like for Indians, we should be able to get it easily. You get it from beans, like legumes, like channa, rajma, cowpeas. You get it from beans group, green vegetables. You get it from mushroom. You also get it from nuts, and it's also present in meat as well. So this is for zinc. For vitamin C, there are a lot of sources. All of you must be familiar with the popular one like orange juice, but there are so many other easy sources. You know, you can get it from kiwi, from all types of citrus fruits, broccoli, spinach, tomato, winter squash. And Indian cooking, there's not a day that goes by without tomato in the cooking. So easily you could get the vitamin C that you need. The mega doses will work if you're, let's say you have already mounted an immune response and you need excess of that. So in the hospital setting, it's monitored, so you can do it. But at home, if you can meet the recommendation, is good. I also have like an upper limit for toxicity. Like at home, if you're sitting and eating a lot of vitamin C pills, there can be toxicity. So just check that out before going into mega doses of supplements at home.
Right. Thank you for that great advice.
I have one question for the trustees. So yesterday I heard in the news that they have a system wherein when you enter the places, you can sanitize the whole body. So
You mean the light, the UV light that passes through you when you enter?
Yes.
Okay.
I'll defer that to Dr.
So are they
Ujjayi
asking that they want that in the temple, or what are they asking?
Yeah, I just want to know how useful
How
it
you
is.
plan to do it,
okay.
yeah.
Well, I've heard that UV light can kill the virus, but I really don't know what if there are any other side effects to it, and what amount of radiation you need to sanitize your whole body. I'm not sure if I'm very much into that kind of a system though.
I thought it has been an established fact from what I see on the TV, it is not a good idea to pass UV light on human body.
It is not good?
Yes.
Yeah, that's what I defer to give my recommendation.
It is not good. The fact that you go out and everybody buys expensive, nice, beautiful glasses to show good to prevent the ultraviolet light. When it is, you are preventing on one side, spending some extra goggles. Apply the same common sense to the other side.
I've been to, I'm familiar with a lot of medical facilities. If that is so effective, I'm sure most hospitals would have already implemented that.
Yes,
So-
they said yesterday in that.
A lot of companies out there who like to make a fast buck,
See, the media,
exploiting the people's sentiments and weaknesses.
I will wait for
And that
science.
is one of them.
I will wait for scientific research than TV news to believe what is true.
I think they were mentioning about entering into football games or something like that. Our temple is also, it's overly populated, people come in, so but it's something we can look into it and see.
Well, thank you all very much for joining us, and thank
Thank
you
you.
the distinguished speakers and the panelists. And Sarve Janas Sukhino Bhavantu, Sakala Sammangalani Sambhavantu. Thank you.